Are you stressed out? Do you not know how to solve your stress? Well, my friend, this might very well be contributing to a lot of pain in your muscle structure, in your face. And frankly speaking, it's probably going to cause a lot of issues down the line if you don't get it solved right now. Stress tends to be an overarching indicator of inflammation in our body. Inflammation is the tendency of our muscles and our tissue to basically swell up when a lot of infection is going there or when things are not healing up as appropriately as they should. And inflammation tends to be associated with a lot of issues in our body. When it comes down to our oral health in particular, stress can lead to people grinding their teeth. And for me as a dentist, this tends to be a situation where I can do very little for my patients. And it's something that so many people struggle with consistently that I feel the urge to tell you how important it is to try to start mitigating that stress in your life. When we go to sleep or during the day, when we find ourselves grinding our teeth, it is a drastic indicator of a response to a stressful situation. My recommendation to all of my patients and anyone that's ever dealing with this is, first and foremost, you got to be realistic with yourself, right? Are you actually going through something that is causing you emotional turmoil, right? What is that thing? Are you willing to confront it? Are you willing to choose to take some actions to mitigate how much it affects your life? And if you're not, do you need help? Do you need help to go and solve that issue? Do you need help to make your life a little bit less stressful? Do you need help from your team, your community to make that situation more bearable? Whatever it is, you got to solve that thing. Otherwise, you're going to continue to grind. It's called bruxism. In dentistry, the term's bruxism. You're going to continue to brux your teeth. And the issue with that is that you end up taking away the top enamel layer of our teeth, and that leaves the dentin exposed. When the dentin is exposed, we have extreme amounts of sensitivity. We have a really hard time preventing cavities decay because the bacteria can go and hit the dentin very easily. And in general, our teeth don't look as nice because they don't have the nice pits and valleys, the nice grooves that a mouth tends to have. The other thing is when we continue to brux and grind our teeth for an extended period of time, we can actually end up affecting these joints up here, which are called our temporomandibular joints, TMJ. There's a misconception that people say, I have TMJ, and everyone has a TMJ, but what they mean is I have TMD, temporomandibular disease. And that tends to be a situation where when we've bruxed and grinded for our entire life because of a stress response or because of a habit that we've built during the nighttime, our joint over here tends to get really worn down. And what that leads to is just opening and having a lot of pain, having difficulty biting on certain sides. Your muscles here can get inflamed. The masseter muscle is kind of the cheek muscle. The buccinator muscles, right? Those are the ones that help close the jaw. There's also this massive muscle called the temporalis that extends all the way, basically like this, all the way up the side of your head. And if you have migraines or you have issues over here that are caused by you grinding or bruxing your jaw, right, that can cause all types of problems in your head. And in general, if you think about it, when you have those types of situations happening, how easy is it to concentrate on things that are really important to you? How easy is it to spend time with our family and to care about the people that we're around when we're in pain, right? How easy is it to make decisions that are important when we're in pain? It's not. It's not easy at all. And the reality is, one of the biggest things that people avoid thinking about is the relationship of stress to all of the different disorders that they have and all of the different diseases that are occurring in their life, right? Stress can also lead to bad eating habits. It can lead to bad sleeping habits. It can lead to bad whatever, right? And at the end of the day, that, in my opinion, is one of the major things that needs to be solved in order to make our overall health a priority. And if you need help, throw it in the comments below. If you need help, there's people out there that can offer you that advice, that wisdom, that necessary step of compassion towards ourselves. Without that, we're never going to be able to solve a lifelong issue. This is Dr. Turab Rai from Franklin.DentalCare and Dentures, hoping you the most beautiful 2025, and hopefully you realizing that whatever that thing is in life that you are unwilling to approach right now, that is the thing that is the cause of all of your issues. Okay? Approach it head on, be courageous. I'm on your side. Take care of yourself.